Hi everyone, I'm here with my Crested Gecko, Tootie. I took him to the vet because he had an abscess on his side, and as you can see, they removed it. He's doing really well the day after he shed, so the wound is already looking amazing. And it's been about 4 days, and he's on an antibiotic, painkiller, and I'm supposed to flush the wound. So I just wanted to show you how I do everything. He's doing really well. He's just a jumpy juvenile. Alright, so the first thing I have to do is flush his wound. So I have my syringe ready, and he doesn't much like this. I'm using room temperature water, so it's not going to shock him or anything. He was going for the camera there. Sorry, this is going to be really hard to show because Crested Geckos just want to climb everywhere. They're not like a ground dweller who's fine just staying in your hand. So I'm just flushing it out, that way there's no debris or anything. The reason why they didn't sew it up, in case you were wondering, is because if something were to be trapped in there, whether that's bacteria or dirt or anything, that can cause the abscess to re-emerge. So they just want all the pus and anything else that might be in there to be flushed out daily when I do this. Generally it goes a lot smoother when I'm not filming. So what my vet said to use to flush out his wound is water with a bit of non-toxic soap. So I'm using 7th generation dish soap, just a very tiny drop mixed in about a cup of water. And if you're wondering, 7th generation is non-toxic. It's a natural formula, so it won't harm him at all. Alright, so we're done flushing it out, and now it's time to give him his medicine. So, as I've said before, Tootie, he has been prescribed a painkiller and an antibiotic. I'm really lucky that I took him to the vet when he's so small, because generally with exotics, their vet care is super expensive, but this only cost me $100 to have the abscess removed and then to have medication prescribed for him. So the antibiotic that he's prescribed is Baytril, and it is marshmallow banana flavored, so it's not hard to give him at all. But the painkiller, which is the syringe I have, isn't flavored, so he doesn't necessarily enjoy lapping this up. So I'm just going to put a dollop on his face. Of course he's going to want to jump. No jumping. And he's not automatically going to lick it up, obviously. So what I do is I switch in between giving him the painkiller and the antibiotic, since he enjoys the antibiotic a lot more. Basically, when you're giving a reptile medication, you just kind of have to smear it on their face and hope that they lick it up. I couldn't imagine giving him a pill. So he lapped up the antibiotic that I put on and took the painkiller that I smeared on his face. So that's the last bit of the painkiller. And I'm gonna, again, encourage him with the flavored antibiotic. Just kind of smear it on his face and wait for him. Come on, buddy. Come on. This definitely requires a lot of patience. Come on. There we go. And I got some on my finger, and it's not a problem. He's gonna lap that up. It just takes a lot of patience. Don't step in it. With the painkiller, I don't necessarily mind if he doesn't get it, because like that's basically up to him. But the antibiotic, I don't want there any chance that he develops antibiotic resistant bacteria or anything. So I want to make sure he gets the proper dosage every time. So the next thing I have to do is dab the wound and dry it off from flushing it out. And it's just like a matter of moving his legs. And I'm just gently going to dab with the tissue. So that's pretty good. And then I just have to apply SSD cream, which I prepared earlier, and I just have it on a Q-tip. And I'm just going to swab. And that'll help the skin grow back better. But yeah, that's about it. It's very easy. And I'm lucky that he isn't like a tegu who can give me a really nasty bite or anything. But he's doing really well. I'm very surprised that he's kept his tail. And yeah, just keep him in your thoughts and hope that he recovers well. Thanks for watching. Please rate, and I'll see you later. Bye!